patients with HIV, they're living longer and they're able to manage their symptoms better. However, we might also expect an increase in non-AIDS-defining cancers due to this extended lifespan and because of this increased survivorship. And as well, a cure for hepatitis C has been developed in recent years and is increasingly available. A vaccination program for hepatitis B began to be implemented in the early 2000s, and the effects of that may begin to be seen in the population as children that may have been vaccinated and adults that are vaccinated may have an effect on the epidemiology and on the rates and absolute numbers of hepatitis B infection in Tanzania. And as I discussed earlier, the study by Julie Campbell at ORCI found increases in non-AIDS defining cancers when she conducted her study from 2002 to 2014. So liver cancers and non-AIDS defining cancers were found to be increasing, along with as well the general cancers at ORCI and in Tanzania. And the aims of this project were to investigate the trends in proportion of liver cancer to all cancers, not only to see the change in liver cancer itself, whether liver cancer is increasing, but also in the context of other cancers, to see if it's increasing at a faster or a slower rate, or at an equal rate, along with other cancers, to see if there are any factors causing a difference between these two. And additionally, we wanted to investigate how the rates of hepatitis and HIV have been changing in this population, and how, if that may have an effect on the changing trends in liver cancer. Finally, we wanted to determine and see if there were any epidemiologic or demographic factors, and if there have been any changes in these profiles in liver cancer patients over time. Logbooks were also reviewed similarly to Beatrice's study, and liver cancer cases identified as liver cancer or hepatocellular carcinoma were identified, and the medical records were abstracted by staff there at ORCI and from the medical records. And then I compared the data abstracted between the Julie Campbell study and my own study in order to see a change over time between the two periods, from 2010 to 2014, and then from the period where the data was abstracted during this time between 2015 and 2018. And additional data was collected from Julie Campbell's study from 2016 in order to supplement, in order to compare these two periods. And onto the results. I found that there was a significant decrease in the absolute number and proportion of liver cancers to all cancers, from 0.88% to 0.65%. But also, interestingly, there was a decrease in the number of all cancers recorded at ORCI. And even taking into consideration there's a 1 year difference in the time period, with 5 years being covered in the Campbell study and 4 years being covered in this study, there is a significant decrease between the absolute number and the proportion of liver cancer and all cancers. Next here, we see the residence of cases where they originated from and how coming to ORCI. We see that there's been a change. There's a general decrease, even when adjusting for the difference in the periods. There's a decrease in patients coming from Dar es Salaam, where ORCI is located, and from outside of Dar es Salaam in the surrounding regions or throughout Tanzania. However, we see that there's a steeper decline in cases coming from Dar es Salaam itself, indicating perhaps that there's a greater proportion of cases now coming from outside of Dar es Salaam. Next we have, this is regarding the case referral origin, whether cases are referred from hospitals in Dar es Salaam or outside of Dar es Salaam. In particular, Muhimbili National Hospital, which is also a tertiary or national level healthcare center on the same level as ORCI. That's where a plurality of cases would be referred from, and patients could be treated for cancer there. However, both there and at other hospitals and or clinics, patients may be diagnosed and sent for referral to Ocean River Cancer Institute for further testing, follow-up, and or treatment. But here we see that there was a decrease in the number of cases coming from or referred from hospitals or clinics other than Muhimbili National Hospital, and that the number of cases coming from Muhimbili National Hospital remained largely the same. However, there was also a decrease. But most notably, that there is a decrease in the number of cases being referred, decrease in the cases being referred from outside of Muhimbili. Onto the changes in infection for HIV, we noticed that there's an increase in the percentage of liver cancer cases that have been screened, or at least we know their HIV status, from 23% to 40%. And of these cases, we can see that there has been a decrease in the proportion of cases that have a positive HIV infection, indicating that fewer of the liver cancer cases are infected with HIV over time. There's a similar situation for hepatitis B. While there is a decrease in the percentage of cases where we know their status, there's a decrease in the proportion of cases that are infected with hepatitis B. And finally, I have another similar situation again with hepatitis C, with only about 2.7% of cases in the 2010 to 2014 period being infected, and no cases of the 77 cases recorded from 2015 to 2018 being infected with hepatitis C. A few points for consideration regarding limitations and interesting aspects that were found from these results. Going through the logbooks, not all the cases that were identified in the logbooks had medical records, and even in the medical records that were identified, they didn't have all the information that would have been abstracted. So there is a lot of missing information in these paper records. Additionally, as I mentioned before, there was an unexpectedly low amount of liver cancer and in total cancers in 2017 and 2018. And this is contrasting with the earlier study, which indicated an increase in non-AIDS-defining cancers and liver cancer. And finally, it's interesting to note that this appears to be an increase in the proportion of cases coming from outside of Dar es Salaam rather than from Dar es Salaam itself. And these changes could be associated with improvements in treatment for HIV and hepatitis or cancer treatment. Conversely, they could also be due to rapid mortality leading to unreported cases. That last point is due to around the end of the project when we were presenting to some of the doctors and oncologists at ORCI, I found out that there was a change in the standards for diagnosis for liver cancer, in which they required histopathological confirmation for diagnosis, changing that around 2016 from more clinical diagnoses, which may, necessitating these histopathological diagnosis, it could be mandating more bureaucracy, time, cost on patients who, with this type of disease, which the survivorship is low and it could lead patients to either not follow up with care, decide not to seek care because of costs, or the time it takes for them in order to become diagnosed and in order to start treatment. They may die during that gap in which they're trying to get diagnosed and get treatment, which would lead to unreported cases, leading to this decrease in cases around 2017 and 2018, at least for liver cancer. And finally, there also, just regarding information that wasn't recorded, stage and grade was frequently not recorded or specified, and they were usually only recorded as late or metastatic, most likely because this is often in end-stage disease and it's treated usually with palliative care, and it's not, the outcomes for it are usually not very positive. For future directions from here, it will be important to verify the requirement of histopathological confirmation for diagnosis and its possible cause in this decline in liver cancer, and understanding just its role there, as well evaluating the programs for treatment of hepatitis C and the vaccination program for hepatitis B in order to see what their effect might have been on this decline in liver cancer, or at least the reporting of liver cancer. Additionally, conducting similar studies in other regions and hospitals in order to compare results, as ORCI, despite it being a national level hospital, it is in the eastern coastal side of Tanzania, and possibly patients that are living in rural communities on further away in the western parts or the southern parts, they may not be able to access care here, and so there may be different situations, and it would be important to look into that. And finally, in general, it would be important to explore if this change in liver cancer is due to either improving or worsening health outcomes. Along with having the opportunity to learn about the research process and just getting to observe how to do research, as this was my first opportunity doing research, we were also able to observe healthcare in Tanzania, visiting Amana Hospital and Mkuranga Hospital, being able to observe and to see how they treat patients, and as well how they manage to provide a wide range of primary care services at these district hospitals, despite having fewer resources at their disposal, and also being able to learn how they do that and possibly being able to translate it to underserved communities here. And we can see also at ORCI, we were able to observe the HIV CTC clinic, the Care and Treatment Center, and also shadow during grand rounds and just follow around residents and doctors on morning rounds, being able to see the patients and how they treat them, and just being able to understand how the patient experience is here in Tanzania and at ORCI. And not only academically, we were able to be enriched culturally by going to see Zanzibar, going on a safari, and being able to get to know this country better, which previously I didn't really know much about Tanzania at all, but having this experience to be able to learn about this country, the land here, and the people was a very enriching experience for myself, and I was very glad to have this opportunity through CHASM and the McLaughlin Fellowship. And I just want to say thanks to Dr. Solomon, the CHASM department, CUNY, and as well as the staff and faculty at ORCI, and as well as you guys here for listening to my presentation. Thank you very much.